just a little bit about myself. My name is Derek. I'm from Hong Kong. So I came to Canada in 2009. So that's about 11 years now. And when I came, I was in grade 11. So I think I was about 15 or 16 or so at the time. And yeah, so I just did grade 11, grade 12, similar to the rest of the international students. I stayed with homestay families throughout my 2 years. So now I am in third year of my medical training, so medical school. And in the third year, it's called clerkship, and technically, pretty much we just work in the hospital, rotating through different rotations. So there are like few common rotations like emergency department, pretty much a hospital, surgery, anesthesia, psychology, psychiatry, etc. So we just rotate through all the rotations about 6 weeks each, and it's pretty much like work, but that's like our main learning modality right now, is to just go through the wards in the hospital, learning the system. So that's what I've been doing most of the year. Yeah. Yesterday I was in the cardiac OR, so that's the heart operating room, and it was just a patient getting a heart surgery, which takes like 6 to 8 hours. And so in order to be in the room, then you have to scrub in and put on your mask, your goggles, your hairnet, and everything. Everything has to be sterile or clean. Yeah, so that's pretty much what I was doing. In the school system, I think provided me with a broad range of opportunities. And one of the questions that you have from me was like activities that are in school, right? And I participated in like basketball, so I was on the basketball team. I was also in the musical that John Taylor has every year. I don't know if they still do. And I volunteer here and there, not as much as I could have, but I remember volunteering here and there, just getting involved. And I think the environment that John Taylor provided was a very positive environment. But I think most importantly, they kind of brought me out of my comfort zone to interact with other people, to other Canadians, and learn the culture and learn how they function in school. And just kind of putting myself out there was a huge experience, because I think it kind of helps me in the future to, like I said, not be shy. I think like just not being shy and was a huge thing, because playing in front of people, singing and dancing in front of a crowd, that's I think if you can do that, then you'll probably be more assertive in the future. So I think those are kind of the highlights that I had at John Taylor, and those are the things I always kind of think about when I think about my high school time. Like my biggest advice would be to try not to interact with just the people you're comfortable with. I think that's actually the biggest thing that I did. So and I think the best way to get adjusted is to just force yourself to be friends with, befriend some Canadian students, to participate in sports like musical, choir, just anything to bring yourself out there, so you can, for lack of better words, you have to almost blend into the culture, because you are the minority in Canada now, right? So that's probably my biggest advice. If it's definitely worth it in the end. I think for sure it's definitely worth it in the end. And obviously you get job security. It's supposed to be, I don't know yet, but it's supposed to be fulfilling. It's supposed to be fulfilling, especially during these times. If you can make an impact for patients, obviously that is like a privilege. And even now as a student, I feel like I do make some impact with some patients, working in a team setting. So it's definitely fulfilling. And maybe being able to look that far ahead and know that it's worth it in the end might curb some of that negative thoughts that definitely will arise during their application process and the years that it takes to get in. So